Well, the polio virus has been detected in wastewater samples in New York City. Health officials say that suggests it could be circulating locally, and it's possible that hundreds of unvaccinated people in New York State have gotten polio and just don't know it. They're urging parents to get their children vaccinated against it. Polio was once one of the nation's most feared diseases, sometimes causing paralysis and even death. Mandy Gaither has more on the growing concerns, as one official says this is just the tip of the iceberg.
In New York, it's a virus that may be quietly spreading.
We're definitely concerned.
In late July, one case of polio was confirmed in Rockland County in a patient who was unvaccinated. That young adult started experiencing weakness and paralysis about a month earlier.
It's the rare case that causes paralysis. So that means that there must be several hundred other cases in the community circulating before you see this one case.
Wastewater testing in that area found evidence of polio this summer. Unvaccinated and undervaccinated people are vulnerable, and polio vaccination rates in Rockland County and neighboring Orange County, just north of New York City, are about 60% compared with 93% nationwide.
It's not just this community, it's any other community that surrounding it that has low vaccination rates that's also at risk. So the spread is always a possibility because the spread is going to be silent.
Vaccinated adults and children who are immunocompromised can also be at risk. The CDC is considering whether to offer children in the areas affected an extra shot of the polio vaccine. Recommending extra doses to certain groups of adults is also an option.
Finding polio in a country where we've had high levels of vaccination, haven't seen polio cases for over 40 years, is significant. This is just the tip of the iceberg, right? The very, very tip of the iceberg.
I'm Mandy Gaither.
The Food and Drug Administration today issued new safety guidelines. It recommends people take 3 at-home tests to confirm the negative COVID results. The agency says if the first test comes back negative, take a second test immediately. If the second test is also negative, but you still have concerns, wait 48 hours and then take a third test.
More than a quarter of children hospitalized with COVID-19 have lingering symptoms for months. That's what doctors call long COVID. A new study in the journal Pediatrics looked at 358 children affected by COVID-19 and a rare but dangerous complication that some children are experiencing. Researchers found that nearly 30% of those children are still showing symptoms at least 2 months later. The most common were shortness of breath and fatigue.